Olá, boa tarde. Eu sou a
Hello, good
Najla.
afternoon. I'm Najla. I'm a doctorate student in the program, graduation program at the University of São Paulo, and I was oriented by Professor Dualer Soares, and my paper is Anti CAIX CAR T cells in treatment of renal cell carcinoma patient-derived xenografts. So I'm going to talk initially regarding renal cell carcinoma. It is the seventh most common carcinoma in men, and it has a subtype that is also common, which is the carcinoma of clear cells, and it represents 75% of all carcinomas, and it has a very bad prognosis, metastasis, and the average of survival is about 13 months. And from there, you have the necessity to develop new therapies for the treatment of this carcinoma. As I mentioned, we produce T C cells. It's a mechanism of a membrane, and it's overexpressed in several hypoxis tumors, solid ones, and it's a constitutive of this clear cell carcinoma. So this is the target of our CAR T cells. So a bit of this CAR T cell therapy is one as we have a T lymphocyte expresses an artificial substance, and it's associated with an antigen with tumoral cells, and it has some domains with CD28 of transmembrane and extracellular, which is associated to the antigens present in tumor cells, and also the intracellular domain that has two parts, a very important one that has the CD28 and also CD30. And this therapy has been developed and with very great uh, results, but we have challenges for the solid tumors because these cells are exhausted, and it also has issues regarding migration of the solid tumors. So thinking about the challenges that we could find, we worked with a model that is of patient-derived xenograft, and this model presents a great mimetization of the tumoral environment where we can check in real time new drugs for the patients. Well, the objective of our work is to verify the efficiency of the efficacy of this kind of T cells with co-stimulatories of C21 domains for treatment with this model of PDX, and also using low doses of CAR T cells. And these experiments are long when they have the duration of 6 months, and we start with implantation of 3 to 4 fragments of tumors from patients, and we did a weekly follow-up through using ultrasound, and we injected CAR T cells with the animals. We did 2 infusions and also verified the groups for treatments that for control. There's T lymphocytes that do not have artificial receptors, and other 3 groups of therapy, 2 with the certain specificity that you can check on the slide, the details, and also with the CD28 for the cells, and you can verify the growth of the tumor. And we also saw impacts in the life cycle and survival. So the first issues that is relevant for this kind of trial is the characterization of the CAR T cells, and we can see on graph A, the proliferation of these cells were excellent. They grew very much, and the levels of transition went over 90% in all the treatment groups. And after 14 days, these cells are still expressing the artificial receptors stably in the average of 40%. And after 14 days from the infusion, we took the blood of the circulating blood from these animals, and we verified that these cells were there, transducted and proliferating. So we here present the tumoral growth from the variation of the area with the ultrasound follow-up, and we see use two PDX patients and also CAR T cells, and in the CD4, CD8 cells, they presented a robust growth. The control cells grew immensely, and this could refrain the tumoral growth from grow. And it's important for that this construction is better for this model comparing to the control group. So we verify the survival curve, and in the panel on the left, and the treatment with the columns and the treatment. And in this case, we verified that the CD28 group, we did not find any metastasis with the animals that we used for this group. And for the second group, they had smaller tumors, a reduction in size, and they also have better survival rates.
Algumas moléculas para marcadores de exaustão dos linfócitos, né? Foram LAG3, CTLA4 e PDL1, e verificamos que a construção CD28, 2:1, CD4...
We ascertained that the CD4 and CD8 featured a robust reduction in these three markers, so that they almost blocked their presence was almost blocked. Then we've also ascertained toxicity. We know that the therapy has a question of being very effective, but as a counterpoint, there's a problem of toxicity in the patient's body. So we checked the creatinine and transaminases to ascertain toxicity in the liver and the kidney. And we saw that they, in our treatment groups, when compared to the control group, didn't have many alterations. We concluded that there was no noticeable toxicity in our treatments compared to the control group. Thinking of from the prospect of our work, we were able to reduce the tumor growth, basically in the 4-1BB, the CD4, CD8. In addition, this construction didn't indicate any toxicity for animals. And on the super challenging model, which is a PDX, it's very troublesome. We hope to continue this work from the perspective of increasing the dose to look at the effects on tumor growth and the metastasis of these animals. In these animals, we also hope to select patients that express carbonic 9 hydrases and PDL1 to assess from other constructs, a research group that works with these therapeutic groups. But these are KT cells that can secrete antibodies to ascertain mostly the alterations and immunological checkpoints. Well, I'd like to thank my mentor and all my colleagues that took part in this very challenging work, especially because of the PDX model. And thanks for the financial support from FAPESP and your attention. Thank you.